Hi, I'm Dr. Amanda Knapp and welcome to our next newborn video. Today I'm going to talk about sleep training your baby. So what can we expect in terms of sleep from a baby? First off, newborns sleep a lot, of course. The average newborn sleeps in the neighborhood of 16 hours a day. Of course, those sleep periods aren't all in one long sleep episode. Those are divided throughout the day. By 3 months, most babies can consolidate a period of sleep such that they're sleeping about 2/3 of their total daytime sleep in the night, and then the rest of their sleep is divided up through the day during naps. And by 6 months, most normal babies really don't need any sort of feeding overnight, so they're perfectly capable of going 8 to 12 hours sleeping without needing a feeding. Of course, that doesn't apply if your baby has special needs or was born very early or has other medical problems. If you have those concerns, please talk to your doctor. Why is sleep important? Most of us understand that a baby needs sleep. We know that sleep is really important not only for their disposition, but also for their brain development. And babies who don't get enough sleep also are at higher risk of obesity. For parents, of course, keep in mind that forced sleep deprivation has been used throughout time as a torture technique. It's that bad for people, their brains and their bodies. When we're sleep deprived, we can't be the best parents that we can be, and our babies deserve better than that. One problem about sleep deprivation that's often overlooked is that being sleep deprived makes parents impaired in the same way that alcohol can. And of course, we don't drink a ton of alcohol and get in the car and drive our kids around. At least most of us wouldn't say that we do. But frequently, many of us are driving our precious children impaired in the same way because of lack of sleep. It's really important that we sleep, both for our health and our baby's health and for everybody's safety. So one of the first best things that we can do to help our babies develop healthy sleep habits is to, as soon as possible, institute a ritual around bedtime. This should be short and repeatable in exactly the same manner every time you put your baby down to sleep. A typical sleep ritual could include a feeding, maybe a bath, brushing teeth if that's appropriate, and then a book or a song, or both. But they should occur in the same manner every night. Another great habit to get into as soon as you're able is to try to lay your baby down in the crib, sleepy but awake, so that your baby ultimately is putting him or herself to sleep in the crib. That's easier said than done. I totally get it. Keep in mind that, of course, a normal person, babies and adults, wakes up frequently during the night. And an adult, we just sort of change our position, roll back over, and go back to sleep. That's the goal for our babies, to learn how to do that too. There's a famous sleep expert named Dr. Richard Ferber who uses a great example about how our environment for sleep can lead to some problems when we wake up in the middle of the night. And so I'm going to use some examples from him to just explain why it's really important for our baby to fall asleep under the same conditions that will be present when she wakes up during the night. Okay, so his example, which I love, is imagine you go to sleep in your own bed, and in the middle of the night, somebody pushes your bed out into the backyard. When you have your natural awakening in the middle of the night, you're not going to be able to just roll over and yawn and go back to sleep. You're going to be scared. You might cry. You're going to be wondering what happened and trying to figure out how you can get yourself back into the house. So that's not going to be a peaceful awakening. Keep in mind, we do the same thing to babies when we nurse them or feed them or rock them to sleep and then put them down in their cribs. The last thing they knew, they were in our arms, maybe with something in their mouth. And when they wake up in the middle of the night, none of that is present. That's very disorienting. And it disrupts their normal ability to be able to fall back asleep. So we want to make the same conditions be present at the time of falling asleep that will naturally be present when our babies wake up in the middle of the night. Have to pay attention to the light of the room, of course, to feedings. Those shouldn't be the last things in the sleep time routine. There shouldn't be any music or lights or vibration that won't be present when that baby wakes up in the middle of the night. And of course, no TV in the bedroom. That is a problem on so many levels. There are two great sleep resources that I want to point you to that are books. The first one I mentioned is Dr. Richard Ferber's classic sleep work. It's called Solve Your Child's Sleep Problems. The second book, which is a little bit newer, is by Dr. Sujay Kansagra, and this one is called My Child Won't Sleep. This one is organized a little bit differently. It's a little bit shorter, which is great if you're sleep deprived. And it also stratifies some sleep training techniques based on how much crying the parent can tolerate. And we'll talk about crying in a second. In general, most sleep training techniques are based on the idea of putting your child in the crib drowsy but awake, and then expecting that they may not fall asleep right away. They may cry or protest, and you go back and check on them at intervals, but you gradually lengthen the periods between which you're checking on your baby with the plan that they will eventually fall asleep on their own. Keep in mind, the crying here is not the goal. Our point is not to make our babies cry themselves to sleep. Another example that Dr. Ferber uses is we as parents do things that we need to do for our baby's safety. If your baby wanted to play with something dangerous, knife, you would take that away. Even if that action made your baby cry, that's not cruel, that's just parenting. In the same way, we know sleep is so important that a little bit of crying on the way to establishing good sleeping habits is completely worthwhile. These techniques, when implemented and when stuck to, are rapidly effective, but the best way to undermine it is to start and then not be able to keep it up because you find it too stressful. So it's really important to be committed, be on the same page as your partner for sure before you start these techniques, and then talk to your doctor. If you're not sure about how to go about implementing, we can discuss that with you. I would highly recommend those two books. They give some great techniques about how to implement the sleep plan and how to troubleshoot some common problems. So happy sleeping. If you have any questions, please talk to us. We would love to help you.